Today on Sarah Has Questions, we're going to fondle a really good one. Boobies. Sorry, I had to. Kinda. But we're going to talk about breasts. Breasts are way more complicated than I knew about. You know, they change shape, they change color, they're made of things that I didn't know they could be made of. There are so many things to learn about breasts. So let's talk to the doctor. I'm Sarah King, and I have a lot of questions. In this show, I get to ask WakeMed doctors any question I want, and bless their hearts, they have all the answers. Sarah Has Questions is a production of Mix 101.5 and Capital Broadcasting Company, and it's presented by WakeMed. Boobies, titties, breasts, breasticles. We're talking about boobs today here on Sarah Has Questions, and I have Dr. Sindi Diko, who is a breast surgical oncologist, but off air you just called it what?
I'm a boobie doctor.
She's a boobie doctor. We love that.
Yes. Me too. So love my job.
I'm so glad that you do, but you know, I'm really excited to ask you a ton of questions. I think this is the most questions I have for any episode this season.
Fantastic.
So
hit me.
I'm getting right in. We're starting with nipples. Nipple hair. Is it normal?
It's actually very normal. A lot of women have them. Now, if all of a sudden you're noticing that you develop a ton of nipple hair, and then you're also noticing hair growing on your face, losing hair on top of your head, growing like male pattern hair, then you want to look into if something else is going on. But having a few stragglers here and there, very, very normal. You can just leave them alone. You can take them out, whatever, but not abnormal.
I'm not going to go from shave to pluck because that's a whole nother that's esthetician podcast. But does that mean PCOS, polycystic ovarian, or what?
It can, but not necessarily. Not all the time.
Things.
Yeah. I mean, you can just have hair without having PCOS.
Okay.
Yeah.
All right. Some women have uneven breasts. Should they be worried about that?
So I always say your breasts are sisters. They're not identical twins. So they're always going to be slightly different. One is usually a little bigger, smaller. One's a little higher, lower. All of that is very, very normal. If, again, changes, if all of a sudden one becomes a lot bigger, one becomes a different color, we're seeing differences that develop. All of a sudden, going back to your nipples, one nipple goes in when they're both outies.
Oh.
Or you see those changes. Those are the things I want to know about.
Okay.
But otherwise, sisters, not twins.
Okay, got it. All right, I'm moving on to pregnancy and breastfeeding.
Okay.
So what happens to your boobs after pregnancy and breastfeeding? What's reversible and what isn't?
Great question. Before I fully answer that, we're going to go back to a little bit of just breast physiology, what breasts are made out of.
Yeah, let's do that.
So breasts are made of, I think about three major components. We have these things called lobules. And if you can think about grapes, kind of like the actual grapes, those are the lobules. Those are the things that make milk when we're feeding baby.
Okay.
And then we have the ducts, not quack quack like a pipe.
CTS.
Yeah. Yep. Ducts. Those are kind of like the vines of the grape, and those will carry the milk to the nipple when we're breastfeeding baby. So that's the functional unit of the breast.
Uh-huh.
The rest of it is the connective tissue. And there's a bunch of stuff in there, fat, connective tissue, stuff like that. So that's the third part, made of several things. But during pregnancy, and even during our periods, during pregnancy, the lobules and the ducts go crazy. They grow significantly. They'll go into the fat and surrounding tissue of breasts. And this is why our breasts get really large for majority of women. Some women don't, but majority of women.
I was like Dolly Parton. I was bigger than Dolly Parton. It was crazy.
I love that. She probably was jealous of you. But so they will get really, really large. They'll make milk. You have all these estrogen and progesterone changes that happen. And then once those levels drop because baby is out, then milk gets produced. Some women cannot breastfeed, and that is okay. There's, I think, a lot of pressure to breastfeed. And
so much pressure.
Fantastic. If we cannot or you choose not to, it is okay. Ideally, we want it because it's best for baby. But again, like
your baby's going to be fine.
Your baby will be fine. We have good formulas. But those changes, then once you're done breastfeeding, everything kind of goes away. Your breasts have these programmed cell death is what it's called, where all these cells that went crazy will shrink back down.
You just named my new metal band.
I love that.
Programmed cell death. Yeah.
I hope that's a rock band. Metal.
Yeah, metal for sure.
So I've done a little bit of research on figuring out, well, do breasts then automatically just become saggy after you breastfeed?
Yeah, that's what everybody wants to know.
And the study that I read said only about 55% of the time. So that's still majority. But what really happens is your breasts grow so much and then they shrink and you have this kind of deflation.
Sure.
But what really holds your breasts up are these ligaments that connect the breast.
The connective tissue or like ligaments?
Yeah, the connective tissue.
Okay.
I call them, it's not so much ligaments because that's like connecting something.
Bones and bones, yeah.
So it's just these like little pieces of connective tissue.
Okay, like are they thicker than regular?
Usually. So if you were to take it, this is what I'm such a visual person. Take an orange, cut it in half. You know how all the slices kind of converge in the middle?
Yes.
So those same lines, I know there's slices, but still like those same lines, kind of what your breasts are made of, and that will go to your nipple. And so all of a sudden that got really, really stretched, and then they kind of lose their elasticity a little bit.
So will they ever go back?
They will never quite be the same.
Yeah, well, neither will your life because you have a baby
and
now.
You have an offspring. And same thing happens as we age. Like a lot of this connective tissue and gravity, not really our best friend when it comes to boobies, but those connective tissues get stretched out.
Yeah.
Fat stretches out, and so they will never quite be the same.
Okay, well, let's talk about helping to fight against gravity, and that's a bra.
It's a bra,
so
yes.
should we be wearing bras?
So bras are fantastic for back and shoulder pain, really, because they're not going to help with saggy boobs, medically known as ptosis, but it's...
it's got a name.
It has a name. It's PTOSIS, ptosis.
Ptosis?
Yes.
I don't like ptosis. Nobody likes ptosis.
I know.
It's the worst, but it is what it is.
It is. It's a beautiful thing getting older, though, right?
Oh, no, it's a privilege.
Yes.
I am a big person on that camp.
So as we age, everything kind of, gravity takes over. And also our breast tissue gets replaced with fat, so then makes it even more saggy, essentially, as we get older.
So is it the lobules that get replaced with fat?
Lobules and ducts, eventually. Because you don't necessarily need them after menopause. You're not going to be having any more babies after menopause.
Oh, man.
Really?
No, I mean, but then your boobs start to sag. That's what.
Yeah.
Yeah.
Majority of the time. But bras will really help with shoulder and back pain, especially if you're a larger breasted woman. They're not necessarily going to prevent our boobs from sagging. There's really
nothing you can do.
I took a deep dive into this. There's no evidence that says it does. I'm sorry.
Interesting. Well, I one time heard that underwire bras can cause cancer.
I don't think there's any merit to that. Underwire bras can cause pain.
That's for sure.
And I think it can kind of give you this like false sense of support. I think especially if you're a larger breasted woman, I would highly recommend going to a specialty bra shop for larger breasted women, and they will make the girls look
I've got a girl.
Yeah.
I've got a girl. I am a larger chested lady, and I call her the bra queen.
I love that.
And she has a swoop and scoop method. You swoop the skin from underneath your arms, and then you scoop it up underneath your boob, and then you place it in the cup.
Oh, that's
and
nice.
then your wire should be directly under your boob, not low.
Yes.
And once she taught me that, and I was like, these girls are locked and loaded, honey.
Beautiful. Victorian era. Is that Victorian era where they're like up here?
Yeah, that's fine. That's fine. Should we sleep in a bra?
I could not imagine sleeping in a bra, but that is just me.
I do.
For some women, it helps because it can be painful not having one. Sure. If you want to, you go for it.
Well, to be candid, I never wear an underwire bra to bed. Yeah. That's just miserable. Underwires, no. I just get like a bralette, but I don't think a woman of boobs my size should call it a bralette. It should be like a bra more.
Shame.
But it's all about like, I don't want to wake up and like the ladies flopping out of my tank top, That's really what it's all about.
And that's okay.
Yeah.
If you feel more comfortable, you have at it.
Yeah, but there's nothing medically saying that we should do it. Gotcha.
No, unless it's like super, super tight and it's constricting your breathing, that's not a good idea.
Oh,
but
no.
You'd want it to be comfortable.
Yeah, of course. What is happening biologically when our breasts are sore before our period?
Beautiful question. It's very linked to what's happening like when we get our period as well. So we as women we have two hormones that really play a role in our lives. We have estrogen that peaks, and then progesterone that peaks after that, and they have this beautiful wave that they're constantly one's up, one's down, so on and so forth. So the week or so before we actually get our period, our breasts are also getting ready to, if we were to get pregnant, to be able to make milk and undergo all those changes that we talked about that happen during pregnancy.
Yeah.
So they're going to get large because they're like, hey, we have to make milk. Everyone get ready, troops align. And then they shrink back down when we have our period, we're not pregnant, the lining of our uterus sheds. And you have the cycle. And over time, that can lead to what's called fibrocystic disease. And women can have really painful breasts during their periods because you'll have this cycle of growth, shrinkage, and that can form scar tissue and cysts. So that can be really painful. Caffeine can make that worse.
Yeah, I remember I was in college and I kept getting cysts because of caffeine.
Yeah.
So it's common.
It's very common. It's usually one of the first things I say, how much caffeine do you drink and what if you stop it? And a lot of women actually improve significantly.
Oh, good.
Yeah.
Well, that's an easy fix.
It is an
kind
easy
of.
fix.
I mean, depending.
Yes.
What can you expect in terms of breasts during perimenopause and menopause?
So perimenopause is this window that ranges in your 40s. Some women even as early as like late 30s, but in your 40s. The average age of menopause in the U.S. is about 51, 52 years old. And so perimenopause are the years before you go into menopause. And you're having these different fluctuations of how spaced out your periods are and your estrogen levels. So your breasts are... They're going to be undergoing similar changes as far as like when you're having those estrogen swings, I guess.
And you never know when they're coming when you're in perimenopause because things are like off rhythm.
And that's going to happen when you're really close to menopause.
I see.
So that's like within that year right before menopause. They're all over the place.
Interesting.
But before, they just tend to become a little more dysregular, not like all over the place. That means you're pretty darn close.
Okay.
Within like a couple of years. But perimenopause can last a while. And so your breasts will start eventually getting less active because your periods are not as cyclical. They're not as regular.
Okay. Let me ask you about nipple discharge.
Yes.
Is it normal to have that during pregnancy?
Yes.
Okay.
It's normal to have nipple discharge kind of throughout your whole life, but here are the things about nipple discharge. The nipple discharge I worry about is clear or bloody. I have seen all the colors of the rainbow-ish. I've seen blue, I've seen green.
I've seen blue?
Brown, I have seen yellow, I have seen white, I have seen so many different colors.
And blue didn't
no,
concern you?
You'll have cysts that are filled with blue stuff, so that doesn't concern me at all. Why exactly happens, I don't know. I can find out the answer and let you know, but I don't know. But so clear and bloody nipple discharge is what I worry about. And then there's also two things. Spontaneous, meaning you're hanging out, you're watching TV, and you literally see your nipple dripping.
Like when you're breastfeeding.
That it's clear or bloody.
Okay.
And if you're a not lactating woman, so you didn't just have a baby and you're having like milk coming out, those are the times I would worry about milky discharge. But when you're pregnant, I don't worry about it. But spontaneous, right? It just
happens.
The provoked is when we're having any sort of stimulation. So squeezing your nipple, leave your nips alone. Stop squeezing them. It's not helpful. You're going to stimulate. So your brain's like, oh, we're getting stimulation. Let's make stuff. Right? So don't do that.
Okay.
But exercise, sex, shower, just really like messing with your nipples, that will stimulate them. And if you're having discharge then, my first thing is stop it. Leave it alone. Continue to have sex, but just be mindful.
Yes,
right?
yes.
The other ones, when it's really spontaneous, that's when I worry about clear and bloody.
What could it mean?
We always worry about an underlying cancer. So those are the reasons why those two things I worry about.
It's so funny. A friend of mine back years ago, she was like, I sometimes have bloody nipple discharge. And I was like, that can't be good, girl.
Yeah.
Turns out she had breast cancer.
Yeah. So if it's bloody, I want to know about it.
Okay. Good to know. What are fibrocystic breasts?
Similar to what we talked about, of your breasts have, so fibroscar, cystic, cysts. So there's scar tissue and cysts within them. And that just means that they're kind of lumpy and bumpy is how they feel. And it can be more painful for some women, especially during their periods.
Okay. And is it harder to do like a self breast exam with someone like that?
It can be, definitely, because you're not, especially as if you're doing them on yourself, you're like, well, I don't know. Is this a lump? Is this just what y'all call fibrocystic disease? It can be more difficult. The thing about breast exams and self-breast exams, just be aware what your breasts are normally like. Okay. So if you are someone that's doing regular breast exams on yourself, pay attention. I wouldn't do it every day. Give it some time because you won't notice subtle differences if you're doing it very, very regularly. But have an idea of what your breasts normally feel like. And then if you notice something that's different, let me know.
Okay.
Or let your OBGYN or your primary care doctor know.
Okay. As we age, we lose collagen. Will the loss of collagen affect our breasts in any way?
I don't know if it's specifically collagen, but it is those tissue, gosh, what's the exact word right now? But it's the connective tissue within your breast. They're called Cooper's ligaments.
Cooper's.
Yeah, and those are the things that will hold your breast up, and then as we age, they kind of lose.
Hit your knees.
Yeah.
Yeah. It's all right.
If you have larger breasts,
I know it's coming for me.
People like me, they're going to stay up for a long time.
No, mine are going to have traveling in their future.
Love that.
It's all good. Like I said, well, I always say aging is a privilege. It truly is. If you have breast implants, first of all, I always imagine people with breast implants, once they've passed, they're just like, skeletons with saltwater bags on top of them. I've always thought that, which I think is hilarious. But if you've had breast cancer or whatever, you want big boobs, who cares? It's fine. But does it make it harder to detect cancer? Or does it make it harder to do a self-breast exam? Do you have to go in for a mammogram?
I think any woman over 40, or if you're high risk or have a family history, should be getting mammograms. Breast implants, no breast implants.
Okay.
But breast implant, depending on how big the implant is and depending on how much breast tissue you have, can make a mammogram harder.
Oh, yeah,
I will
sure.
say, because they have to push the mammogram out, they have to push the breast implant out to then put the breast tissue on the plates, on the X-ray plates. I will say our technicians at WakeMed are amazing they are magicians. They will maneuver the breast in different ways, so they will push that implant aside and we can see it. It can make it a little bit more difficult. The breast exam, not necessarily, because the implant usually goes behind the breast, behind the breast tissue. Sometimes they'll go under the pec muscle and sometimes before the pec muscle, but it's usually under the breast tissue, so I can still feel it pretty well.
Okay. Just out of curiosity, because mammograms, I get one every year. I'm a big fan, big proponent. Everyone should get them. But it is like you're making love to a machine.
Oh, yes.
Are there any advancements coming in that way? Is there any other way we could do it aside from the way that we're having to do it?
As far as mammograms go, not that I know.
That's all right. I was just hoping.
I know.
We were all just hoping.
I know. But I mean, the good thing about mammograms, that what has changed in the last, I don't know, however many years, the fact that now we have 3D mammograms, they're so much better at looking at even more dense tissue. And so there's those advancements.
Well,
but
the ones
not
that
so
really
much,
matter. But I mean, it would be nice if they were more comfortable.
Yeah. I would recommend that before your mammogram, especially if they are really uncomfortable for you, take some Tylenol or ibuprofen, like 30 minutes to an hour before. That will really help. But
okay.
Yeah.
That's good to know. And don't wear deodorant. I always forget.
Yeah.
What are some changes in breasts that women tend to ignore but shouldn't?
I definitely see this in all age ranges, more so in my older patients. But when you get out of the shower, this is what I tell my patients. When you get out of the shower, look at yourself in the mirror and do your breasts look the same? Is all of a sudden one of your nipples, like I said, an innie when it was an outie? Is there any like scaling around your skin?
What do you mean by scaling?
Like eczema almost, like this like
got it.
red, scaly type thing. Notice if there's any of those changes. Notice if the skin just looks different, and notice if there's that size difference. So a lot of what my women, especially my older women, ignore is just the visual differences of their breasts.
Are they ignoring it, or are they ignoring the mirror altogether? Because, a lot of people as they get older just stop looking in the mirror.
Great. Yeah, great point.
Yeah.
And I think they're not being, no one else is looking at their breasts either, and so it's hard. This is a very challenging area, but those are the things I really don't want anyone to ignore. Like I have seen women where the breast is like the nipples all of a sudden up when it was down, or if you like raise your arm, sometimes you don't even have to, but if you raise your arm and you see all this new dimpling that wasn't there before,
right? It's
a lot of the physical signs.
Okay, so it's very important to look at your breasts in the mirror. Okay.
Yeah. Just tell yourself how pretty you are every day. I think it works.
Okay, yeah. Fake it till you make it, right?
Yeah.
Which you're not faking it. You're just being hard on yourself 9 times out of 10.
Yeah.
Are there symptoms of breast cancers that do not involve a lump? I'm assuming it's what you just mentioned.
What I just mentioned. So that skin retraction, those skin changes, you can have some thickness, some redness that isn't going away. It almost looks like an infection, but with antibiotics, it doesn't go away. Those are things I worry about. That scaliness of your nipple. That's
the discharge.
The discharge that we talked about, yeah. And oftentimes this doesn't have to involve a lump. And there are cancers that don't quite present with lumps. They're a little more... they tend to spread out a little bit more instead of clumped together to make a lump. And so that's why these other physical findings, are really important. And you're with yourself every day. So
Sure.
be your advocate and then let us help you whenever we can.
Okay. All right. We do have listener questions.
Great.
First one, I have large boobs, and I always assumed that I had big boobs because that's where my body deposits the excess fat. And is this true?
It can be. So part of your breast can be a lot of fat, but you could also be someone who genetically has a lot more breast, like the
Tissue.
The functional unit of the breast, which is what I talked about in the beginning, those lobules, those ducts, like that kind of breast tissue. And then you could also be someone that's where you store your fat. So, so yes and no.
Okay. And as you get older, then it's going to be more fat than anything else.
Usually, yeah, that breast tissue will get replaced. And I have some women who, up until their 80s, they have very, very dense breasts, but majority of the time, your breast density goes down because that functional unit of the breast gets replaced with fat.
Got it. All right, last question. Every time I get a mammogram, my results tell me that I have quote unquote dense breast tissue. Is this good or bad, and does it matter?
So dense breast tissue, radiologists will give this usually a rating of A, B, C, or D, or they'll have like some associated words with it. And what that means is when you're looking at a mammogram, it's a black and white X-ray. It's a film. The more dense breasts we have, the more of that dense breast tissue we have, the more white it looks, and the fat looks black. And so cancer can also it does look white. And so this is why the more denser breasts are, the more difficult it is. And if you ever look at your report, if you have density C or D breasts, they will say it makes it much harder to detect small masses because you have dense breasts. So having really dense breasts does increase your risk of breast cancer. Another reason why it's very, very important for us to get our yearly mammograms and monitor, because even with dense breasts, those 3D mammography that we talked about can look through the breast and can see if there's any of those subtle changes, which are really, really important.
So it's not the fact that your breast is dense that makes you more likely to get breast cancer. It's the fact that you might miss it in a mammogram?
It's actually both of those. Like having just more dense breasts intrinsically can put you at higher risk for breast cancer, but it can also make it harder for a mammogram to see things, which is why having that consistent mammography is really helpful. And then at some point we talk about when do we want to supplement with other things in addition to the mammogram, such as ultrasound or MRI.
Wow.
Yeah. So there's other stuff that we can do.
And how will we know when it's time to go that route?
It will be dependent on the density of your breasts, like how dense they are. What is your family history? What are your risk factors? And there's a couple of things that go into.
So will it be recommended to you? Mm-hmm. Okay, got it. Is there one piece of advice that you would give to women listening about their breasts?
Only one piece of advice?
Well,
I am an opinionated woman.
Okay, give me two. How about two? I'll give you two.
I think I'll bring it back down to one. Have an idea of what your breasts look and feel like, because you will be able to notice those changes before I do.
Yeah, well, sure.
Or if you're not going to a doctor, and just be cognizant or be aware of what they look like and what they feel like, and ask for help when you don't know.
Yeah, don't be afraid.
Don't be afraid.
Yeah, just go in.
Oftentimes it could be nothing, but let us figure it out before it becomes something.
Well, and even if it does become something, from what I understand, breast cancer is much more curable now than it has ever been, which is wonderful.
Yeah. I love this job because we really can cure cancer.
Which is
fantastic.
Awesome.
Yeah.
I love how passionate Dr. Diko is about what she does. On the way out, she stopped me and was like, I forgot to say two things. So here are those two things. One, nipples change color throughout your life. If you have a baby, it darkens quite a bit because the baby needs like a bullseye to be able to see it and get milk. I think that's so cool. And then secondly, and in her opinion, most importantly, get your mammogram. It can save your life. Is it a little uncomfortable? Yes, but it can save your life, so who cares, right? Thank you so much to Dr. Diko and to WakeMed, as always, for making this podcast possible. Tell a friend about our podcast, and if you have any questions or maybe an idea for an episode, hit us up on Instagram. We're at Sarah Has Questions. I know it's a really unique handle. Until next time, guys, stay healthy and be well.